Today we are going to look into the major topic in psychiatry, which is rehabilitation in psychiatry, which is a vast topic in psychiatry and a practical thing. But today we are only going to see some theoretical aspects of this topic, and which you can see here. Rehabilitation psychiatry is a well-structured program, and there's a clear definition given by the United States Psychiatric Rehabilitation Association, which psychiatric rehabilitation promotes recovery as well as full community integration and improved quality of life for persons who are with any kind of mental disorder and impaired livelihood. So from this definition, you can get a clear picture what rehabilitation in psychiatry is and what are its main uses. And to provide rehabilitation for a psychiatric patient, first we should decide a treatment setting which suits for our patient. It can be either a day patient center or an outpatient center or any kind of residential facility, which can be an intermediate care unit such as KUDIL, which is in our setup, and also some long-term care units which are also available in our nation. And here you can see from this slide, it is a website which is maintained in our country, and it's an online directory for mental health and psychosocial service providers. And it's a directory, you can log into that and see what are the psychosocial services available for us in Sri Lanka, and also some guidelines for managing common psychiatric disorders. And this slide shows a photograph of that website showing intermediate care units available in Sri Lanka. You can get their names as well as who are the medical officers in charge of that, and the contact details of them. Here, highlighted in red box is the KUDIL, which is available in our treatment setting in Base Hospital Telipala and in Chahacheri, which we will be seeing that in the later slides. And now we're going to see the major differences between pharmacotherapy in psychiatry as well as psychosocial rehabilitation, which we should get a clear picture to differentiate these both aspects. Whereas the pharmacotherapy mainly focuses on removing the disease symptoms by diagnosing a psychiatric condition and prescribing drugs for them. Whereas in psychosocial rehabilitation, it focuses mainly on the person itself, opposed to the diagnosis of mental illness. And in pharmacotherapy, it focuses on the symptom relief of the patient, but in the psychosocial rehabilitation, which mainly focuses on the recovery process. And pharmacotherapy, we will provide a short-term treatment mainly by drugs for a patient, whereas in psychosocial rehabilitation, we will provide a set of aspects like social status improvement and occupational roles and independence with the community. We'll help the psychiatric patients to improve these main aspects in psychosocial rehabilitation. In pharmacotherapy, we won't use the community integration as a treatment, but here in psychiatric rehabilitation, the full integration of a patient into the community is the pivotal role of that. And this slide shows the personnels involved in providing psychiatric rehabilitation for a patient. First of all, we'll see each and every staff members and their stipulated roles in providing psychiatric rehabilitation. The psychiatrist, who is the coordinator of this process, and he will diagnose the psychiatric condition and provide a medical diagnosis, and he will prescribe drugs and other modalities of treatment like ECT for the patient, and make the psychiatric patient ready to undergo into the psychiatric rehabilitation process. In here at Jaffna, the other staff's roles are also mainly played by the psychiatrist himself because of the lack of staff and other limitations present in our society. But there are occupational therapists and nurses who are two main officials playing important role in providing psychiatric rehabilitation. Nurses will provide a clinical supervision for a patient and also manage their medication and facilitate in providing therapy. Whereas the occupational therapists, who are the important personnel in providing psychiatric rehabilitation, they'll plan and provide activities to solve problems and express emotions, to help the patient to express their emotions and to develop new skills among the patients. And there are three other officials like social workers and rehabilitation counselors and clinical psychologists. The social workers, they are the primary contributors for the follow-up care of the psychiatric patients. They will assess the psychiatric patients in terms of their familial and social and environmental factors which led into the familial dysfunction or not. And the rehabilitation counselors, they will manage the case entirely and help in improving their occupational skills and some of their coping skills as well as some preparation for their academic purposes. And the clinical psychologists, which we rarely see in our setup, they will diagnose and assess the treatment effects which we have given to the patient and the progress of that by using various tests and inventories. And this diagram shows you the process of entire psychiatric rehabilitation, which is described into three distinctive phases. The first phase will be the diagnosis phase, the second will be the planning phase, and the third and last will be the intervention phase. In the diagnosis phase, the psychiatrist plays the important role and he will diagnose a condition and provide acute medical treatment to normalize the acute condition and assess the readiness of that particular patients to undergo into psychiatric rehabilitation process. If the patients are ready to undergo into the psychiatric rehabilitation process, they will further proceed in that process. If not, they'll provide some support to make the patient ready to undergo into the process. After the diagnosis, they will plan the entire psychiatric rehabilitation according to the functional assessment of each and individual patients, which is mainly done by the occupational therapist, also by the psychiatrist here. In the second phase, they'll plan mainly the skills development and the resource modification of them and plan what are the interventions they are going to give for each and every patient. And the last intervention phase, they will provide of various interventional techniques which we will be seeing in the next slide, mainly focusing on the direct skill teaching as well as skill use programming and the resource coordination and resource modification. The important thing is whichever the phase we are going to develop, each phase it will be monitored by two processes. One will be the tracking process and record keeping. Tracking the entire process will give us a clear insight of the steps they are in good track or not. And the record keeping will give us an insight to monitor the entire progress of the psychiatric rehabilitation. And this diagram shows you clearly the four phases in the vicinity of the environmental setting and the core values. In this slide, we will give you a clear picture of what is happening in a psychiatric rehabilitation process, the entire process in a nutshell. First, we will assess the patient, their functional status in terms of various topics like self-care, if they're able to do their self-care activities, and their basic living skills, and also education. Some patients, they may have good education background, some may not. And the employment. Some psychiatric patients, they have a early employment, but some are unemployed. And the relationship issues, how they are able to maintain relationships with the family members and the neighbors and others, and their leisure and social activities. Assessing the functional status of each and every psychiatric patient in these terms, we'll get an overall picture for each and individual patients in which status they are in terms of functional status. With that, we will plan a patient-tailored psychiatric rehabilitation rather than providing a prefixed, a cooked psychiatric rehabilitation program for every patient. And we will plan this patient-tailored program in terms of various topics. We will consider some goals which can be short-term or intermediate or long-term goals which we are going to develop in those patients. And we will modify and identify the resources which are available to us to fulfill those goals. And we will optimize the treatment of the psychiatric patients by providing proper medication and get them ready to undergo into this process. And also we will provide a particular time frame to achieve this process in near future. And we will provide them with various interventions like occupational therapy, vocational training, and social skills training, and also more importantly, cognitive therapy and cognitive remediation. By giving these various interventions, we will try to achieve a functional improvement in this patient. And more importantly, we should measure our progress by various tests. And in giving this intervention, it is important to provide some kind of rewards and modeling or feedback. It can be either small prizes or even an appraisal for the patient to believe that they are doing well in this process. And we can go in cycles. First, we can assess the functional status and plan a patient-tailored approach, and we can provide with various interventions by various means of interventional therapy, and we can assess how they are improved or not. And we can provide some rewards and facilitate the entire process, and we can go in cycles to achieve a fruitful outcome in a long run. And this slide, we will see the main aspects of the inpatient rehabilitation which is provided in the most inpatient setups in our wards. The main thing would be the psychoeducation, which we are giving the psychiatric patients regarding their illness, and to diagnose early warning signs and to diagnose relapses so early so they can admit them earlier, and what to do in a crisis, how to intervene in a crisis. These main points will be tackled in psychosocial education. The next thing will be the family intervention, which will mainly focus on the psychoeducation to the family members and tackling some communication and problem solving skills and stress management for family members, because the psychiatric patient, they'll spend their more time with the family members and they have to manage themselves in the family setup. So they may be put under great amount of stress. So we should advise and we should support them to overcome those stresses and to provide a good care for their patients. And activities of daily living and management of daily routine and grooming and personal hygiene. These are main three topics which we normally use in our inpatient ward setup. And we can use these things to assess the improvement of the psychiatric patients. These things will be normalized and they will improve in these aspects when their disease is remitting, disease is going into remission. And next thing will be job searching and matching. Some psychiatric patients, they may have their own jobs, but they may be deteriorating in functioning. We can support them, or else we can improve some skills and some self-employment aspects for them and support them and put on immediate placement, or we can find a job in the future. And effective use of leisure time also plays an important role. And then regarding the illness management, the cognitive remediation, which is we are giving a new info regarding a process and individualizing the treatment to develop that habit into their real life, which is an important technique we use in psychiatric rehabilitation. And social skills training also important to improve self-care and conversation skills and to make some friends for psychiatric patients. And in the following slides, we will see available facilities and therapies which are available in our setup. These photographs shows the occupational therapy center which is available in our Telipala Base Hospital Psychiatric Unit. You can see here psychiatric patients leisurely involving in indoor games like playing carom, and this picture shows the handicrafts which have been made by our own patients by providing good occupational therapy. And this picture shows the active involvement in vocational training like sewing. And this slide, you can see a well-structured kitchen setup, which the cooking practice will be given by a facilitator for our patients and try them to involve in cooking setups and improve their cooking skills, which is also considered as an occupational therapy. And this slide shows a form of intervention which we use in psychiatric rehabilitation, because our Jaffna society is mainly a farming society, is an agrotherapy. Will help the psychiatric patients to improve their skills in farming. And here regarding physical exercises, we'll encourage them to involve in physical exercises in group activities and individual aspects, which will improve their social skills and help them to overcome their acute physical illness. And this slide gives you a clear picture of the intermediate care unit, the hut, which is also called as Kudil in Tamil, which is available in our setup, which is looked after by the base hospital Telipala, which is an intermediate care unit, which patients will be placed for about 1 year and try to improve their skills and aspects, let them to integrate into their family successfully in later life. And here you can see the patients are get together and involving in reading newspaper, and which is facilitated by a facilitator, which will improve their social skills. And also they are involved in various craft work. Here you can see a photograph of psychiatric patients using palmyra leaf and making some handicraft works, which will improve their vocational training and may give them aspects of self-employment in later life. And regarding vocational training, they also taught how to plant and the secrets of planting. In this slide, you can see they are given insight on how to rear chicken, and this also may be used as a self-employment technique by several patients. And here the patients are get together and they're involving in group play activities, which will improve their social skills training. In this slide, they are involved in gardening, which may be used as a remedy for them in their home setting in the future. And as you can see here, it's a good outcome by providing a well-structured psychiatric rehabilitation to a psychiatric patient and developing skills, supporting them and supporting their family members, we can able to get a fruitful outcome. You can see here the handicraft products which have been made by our own patients after going into a well-structured psychiatric rehabilitation program. And thank you. And you can see various references on psychiatric rehabilitation. There's the Essentials Guide to the Psychiatric Rehabilitation Practice, which is a book published by the Boston University Center of Psychiatric Rehabilitation. They also have their own website. And you can refer to a textbook of psychiatry by Professor Varner De Silva and also the Oxford textbook of psychiatry. And thank you.